All right, y'all, we are now in chapter 7. This is the respiratory, hemic, lymphatic systems, and the mediastina and the diaphragm. In this section, we will be talking about all those systems that I just said. There's some basic respiratory system information that you all might want to go over again. And I know we've already talked about this one a couple of times already. Knowing what the larynx is called, your voice box, knowing the process of the larynx and how it functions. This little paragraph right here is going to be very important about how the larynx functions, or your voice box. Then right here you have the trachea or the windpipe, to know what it consists of and how it functions as well. So make sure you know that. Okay. Here is the tracheal, bronchial, and bronchioles. This is your bronchial tree. Okay. I think this is in your CPT book as well. So if you need to make notes, that's the place to do it, y'all. The tracheal branches into the right and left bronchi. Go back and read over this. It's important. Some key roots, suffixes, and prefixes for the respiratory system. They are probably in the CPT book, not completely sure, but if you cannot remember, the synthesis, the pinea, the peri, the phonia, the rhino, the broncho, the laryngeo, the trachea, the pleura, the pulmo, the freno, the pneumo, the spiro, make sure you make a note of it, because they're going to be important. They expect you to know those terms. Those are basic terms. So please make sure you are up to par on those as well. And these are just going over some of the different diseases. We've talked about those a little bit. Make sure you are able to effectively go through and code these things, okay? Make sure you really go back and read. Also, you all, the chronic obstructive pulmonary disease, knowing when to use what form of that diagnosis. Make sure you go back and read over this with that COPD and that asthma, because sometimes you will be able to use a combined code and you need to make sure that you know when. So that would definitely be some information that you would definitely put in your book, okay? Of course, we've talked before about V codes. We use V codes when a definitive diagnosis cannot be coded. And you remember I told you that our V codes are kind of like our preventative medicine codes. You don't actually have the disease or an issue. You are just doing kind of preventative medicine services to keep that patient from getting sick. So that is really what a V code does. We talked about the diaphragm a little bit, and we talked about how the diaphragm aids in respiration. As you all remember, when we inhale, the diaphragm flattens, and as we exhale, the diaphragm goes back into that dome shape, which pushes the oxygen out of our lungs. Remember that, you all. Remember. And here's just the respiratory system, knowing the different things that are housed in your respiratory system. Another word for nosebleed, you all, is that epistaxis. That is one that you probably will see. Sinuses. Y'all, this is a trick question on the test. How many sinuses do you have? Well, if you look at this diagram, you have the frontal sinus, the ethmoid sinus, the spinal sinus, and the maxillary sinus. So if we look right here, it looks like we have what? Just 4 sinuses. But this is a trick question. Right here is the nasal septum, right here. It separates the sinuses from right and left. So in actuality, we have 8 sinuses, because we have a right side and we have a left side. Make note of that one. That's a trick question. You're probably going to see it on the test. So make sure you know you have a right side and a left side, because the nasal septum, which is a separator, it separates the right and the left side. Okay. And these are just some procedures that you're going to see. You can always go back and read over this information. Okay. All this information, guys. This is just for you to go through and read over. But the thing is, when they tell you what the diagnosis or procedure is in this part right here, you know you just got to go and look out. That's all you have to do. Again, the mediastinum and the diaphragm codes. The hemic and lymphatic system, what they consist of. Okay. Medical modifiers found in this section. Make sure you go back in the glossary. Know these terms. Know what they mean. Okay. You may see them. So make sure you know what these terms are. Alright. Chapter review questions, y'all. It's not mandatory, but I do encourage it if you go back and you try to answer these questions. All right, y'all. That's it for chapter 7. Cut and dry with that one. We will resume with chapter 8 in just a minute.